surprised you don't have more back pain.
Yeah, and the left side of my back hurts most
Yeah, that's
of the
what I
time.
think. That's a short leg
Yeah.
side. That's where you're hypercontracted.
Yeah, it hurts there most of the time.
It's
Just not
tight.
as much
It's tight,
as my,
right?
yeah, it's
Yeah.
Very, just very tight.
Okay. I'll notice the right levator scapula from the,
Yeah, sure.
and then bilateral, like lower neck tightness.
Interesting.
From the desk jockey computer.
Uh-huh.
And then there's a whole new way the neck compensates with the phones.
Right,
It's a
sure.
mess.
Yeah.
It's so much more.
Yeah, it's ruining everybody.
What happened to you again? Trauma-wise?
Nothing. I
Just
specifically
repetitive?
remember, yeah. You know, I started thinking about it after I was here, and I can remember one time when I was young and I had been riding wave runners all day long, and like the next day I could barely move my head. So I don't know if it was that.
Yeah, that'll do it. That'll do it. Anything that sprains the ligaments in the spine, that's what we're playing.
Your baby's so beautiful. I love
Being good, right?
baby. She's so beautiful.
You said you had a baby.
I have an 18-month-old
Aww.
little girl.
So how long were you sleeping on, like 2 hours, 4 hours of sleep?
For a while, she was like just wanted to nurse all the time, and so
Yeah.
yeah, for a while.
Hey.
She's still.
Oh, say hi. Say hi. Whoa. What is that?
Alright, and we'll slowly get you in the perfect spot, okay?
Okay.
So just one more tiny little, yep, perfect.
Okay.
Come down onto your side and bring your legs up on the table. Let me see where you land down here on you. Good. All right, Amy, you're gonna hear a click. Last thing, I just want you to let that head relax. Good. Good job. Is your low back feel any different?
It's not hurting at the moment.
Was it though?
Not too much. My left side has been pretty tight today. Yeah, at the moment it feels okay.
Cool. And then you'll notice a different quality on that nerve.
I don't have anything.
Weird, right?
Yeah, it doesn't hurt there at all right now.
Just lets go. You got a good set.
Good.
Basically, Mike is, besides we have every month a weekly kind of, it's a vlog, but an update of what's going on in here and kind of patient stories. And then there's also, besides that, every week, he does sort of a different episode on our channel. 2 weeks out of 4 weeks a month, he's doing one that's related to food, and I'm turning my yard into like a food forest.
Awesome.
So I
Awesome.
only say that because you garden,
Yeah,
You know.
yeah, awesome.
but it's called Doctor of the Future, which is a reference to a quote from Tom Edison.
Yes.
You know what I'm
Doctor
talking
of the
about?
future will use no medicine.
Yeah,
Right.
but will interest his patients in the human frame
Yes,
and the cause and prevention of disease, food,
yes.
right?
Yes.
So instead of meds.
Yeah.
So we're trying to inspire people in Stuart to basically, even if it's on a small scale, like in pots grow berries or bananas or something. How you been doing? How you
I've been
feeling?
doing great.
Body's behaving?
Telling Michael that we're getting ready to go next Monday on our
Yeah?
summer travels.
How
So
do you feel?
about going?
Yeah,
Very excited.
good. I'm jealous because it's already hot.
Yeah.
I'm out there in the yard, like my eyes burn from sweat. How did this happen? Wasn't it cool a little while ago? How long are you gonna be gone?
4 months.
So I want to see people typically monthly, right?
Right.
But even the ones who go for 6 months, unless I really trust the person that's, that they're gonna be visiting,
Mm-hmm.
every time I go through this, I move further away from referring to other doctors because they come back and things are a mess. So I just,
And you know me, and
I
I
tell people to
held
wait.
for years.
right.
So
I've gotten to where I just tell people to wait.
So I thought that unless I had a reason to feel that I needed it, I would just wait. And if I felt I had a reason to need it, I'll call you. How's that?
Exactly.
All right, good.
You're good.
Yeah.
I'm glad you're having some relief.
Yesterday was a really good day.
I hate seeing you when you're in the waiting room and you got the glasses on.
Oh,
And you sort of like
that's how you
want to
know.
kill somebody. Did you notice anything else just besides the reduction in that, like range of motion or energy or anything like that?
Yeah, I had a lot of energy yesterday.
What'd you notice?
I just wasn't exhausted, and normally it's just to sit on the couch and don't want to get up, and I actually did a lot last night.
Awesome.
So,
How'd you sleep? A little better?
yeah, I slept better.
Good.
Only negative I noticed is,
Yeah.
and it might be totally unrelated,
Okay.
but the top of my right foot is bothering me.
Interesting.
Yeah, very weird. It feels like I need to keep popping my toe.
The mechanics will be different on your feet.
Okay,
So it can almost feel like you gotta crack the bones in your feet.
that's what it feels like on that right foot.
Basically, when you're out of alignment, the way that you'll distribute weight one side to the other will be different. It's asymmetric, and your feet also carry slightly different when you walk.
Mhm.
So when I adjust you, there'll be a new settling in of how your foot contacts the ground with like
Okay.
a strike when you walk and stuff. So your bones can almost feel different.
Yeah, it's that top.
Also,
that
the
just-
knees and hips can feel a little different too, so you know, for what it's worth. Because that's a big thing. I got to get you holding
Mhm.
so you're happy. It's not the adjustment, it's holding it
Right.
to where you'll be like, hey, give me a hug. Instead of, I'm going to stab you.
It's when I start to feel.
It can be a little
pressure.
stiff in the beginning. Your neck has a new configuration with how the muscles even hold your head up.
Okay.
So throw your collar on if you notice it's getting a little stiff or tight.
Okay.
So even if it's when you lay. The first couple weeks, especially after a good adjustment, you can notice that. And then all of a sudden you'll just be moving your neck around like you normally would and you don't even think about it. Yeah, I would not adjust you today. We're getting there. If you are at the desk for a while and the neck's getting a little tight with things being so new, throw that collar on for me, okay? Be the weirdo with the collar. You don't realize how good you're feeling until you go back out. It's
Yeah.
kind of subtle, and then
Actually, one weird thing that happened last night. I was in my room. I was walking to the door and I turned to look at something, and then it's like out of nowhere I got it. Like it almost threw out. Like it was right on the edge. I got a really sharp pain, but it was very brief.
you may have thrown it into a little bit of a spasm
Yeah, that's pretty much where it was.
right in there.
Mm-hmm.
That's what I'm feeling. We can lightly try to stretch it a little bit and soften it up. If it cooperates, cool. If it tightens up a little bit more, I'm gonna leave it alone.
Okay.
I'm not gonna go all the way up because that's right up where the atlas is.
Mm-hmm.
I'll stop right about here.
Okay.
And that's the belly of that muscle. You'll feel it. At the house, you may want to hit it with a little bit of heat.
Okay. When is heat and ice appropriate?
So, it's sort of on a spectrum.
Okay.
There's no definitive, and I can even tell you, you know, a certain set of rules, and they may not apply for you.
Gotcha.
But in general, heat is better for your chronic pain, and ice is better for like a sprain, strain, like an acute injury.
Okay.
What you have going on here is sort of on the cusp of both.
Okay.
So you may want to try ice and heat. But just how it feels on my hand, I would say heat would soften it up a little bit and just relax.
Okay.
You're in, Tyler. Good job, man. You can do those on your own.
Okay.
If you notice that things are getting tight, your sort of line of defense is the collar, and then going into that pivot, like if you're at the computer for a while,
Mm-hmm.
you strengthen.
Okay. Cool, man.
You're cruising.
Sounds good.
Have a lovely weekend.
You too, man.
How you feeling? How you doing? What's the latest?
Pretty good.
How'd you do?
I mean, so far so good. I mean, it's the same. Just seems like it's just uncomfortable, but not like it was before. So
Cool. Back in your groove.
hope
You were
so.
adjusted last time, correct?
Right.
Yeah. What have you noticed?
Not much. I mean, before when I needed to get adjusted, I had a lot of tension in my neck, and I had a headache really bad the weekend prior. But it's been a lot better. Noticed a lot of my sinus pressure is gone too. And that usually is one of my main symptoms. So
That's good.
And yeah, you know, it feels definitely better, different.
Different,
you know.
right?
Yeah, I've got
Not
some.
quite stable yet.
Right.
Exactly.
And you know, I still have some sore muscles and stuff in the neck, obviously, but kind of in different.
Does it feel like it's
a
kind of
different
shifting
way.
around though?
I don't know.
Kind
you
of
know, I
guarded?
don't. Yeah,
Yeah.
yeah, I feel a little guarded with it, especially in the first few days.
Just baby it.
So yeah, I've been trying.
Use your body a little bit more than your neck.
Uh-huh.
It
Okay.
won't be like that for long.
Okay.
Maybe a couple of weeks.
Uh-huh.
As long as you don't
Okay.
aggravate it too much.
Okay.
How'd
So
you feel?
hopefully I haven't done anything to mess it up.
That's awesome.
So yeah.
Because that means you took pressure off of the nerve roots.
Right. Right. So yeah, it's happening every night, and it's not happening. Has not happened since. So it's very good.
Cool. Happy.
Yes, me too.
Any change in energy levels, sleep, how you been sleeping, anything like that?
Well, it's been a complicated week.
Okay. With kids? I'm glad you're feeling better. Isn't that neat just from correcting the position of the atlas? That it can do that with those nerve roots?
It is very cool.
Without having to crack you or pop you or anything else?
Yeah, it's excellent that it can be that easy to fix something like that.
Can you feel how that nerve root is not swollen today?
Yeah, it's
Yeah.
certainly not as painful. I mean,
Exactly.
it's not painful at all when you push on it.
Exactly. So I would not adjust you.
Okay.
The atlas is properly positioned and it's where I left it
Mm-hmm. Good.
from last time. You've got some muscles in here that are
Yeah.
waking up or changing. If you notice that the neck is getting tight,
Mm-hmm.
or it's like the end of the day, you've been
Mhm.
doing notes or whatever, and it's throw your collar on,
Okay.
especially for the first couple of weeks.
Okay.
That noise is Parker's tail.
Wow. Yeah, that's sore in there. But these are new areas that are sore.
Exactly.
So they're-
You may notice that it's almost like your body's playing tag
Mhm.
for a little bit. Like, oh my god, I didn't even know I had a thing there.
Mhm.
And then it's gone in 24 hours.
Uh-huh.
Where the body was locked up in a
Mhm.
static, dysfunctional posture and pattern.
Mhm.
Now it's been released, and there's going to be a lot of shifting and changing
Mhm.
as your body gets used to its new normal and
Okay.
really finds it.
Uh-huh.
And then it will be odd and unusual for your body to go back out of alignment
Okay.
because you'll get used to being lined up.
Yeah. Good.
Cool.
Great.
Well, right now it's gonna feel a little bit kind of crazy.
Uh-huh.
Awesome.
Good.
I'm not messing with you.
Okay.
That's it.
Sounds good. That's easy enough.
I'm not messing with you. You're perfect.
Very good.
Good job.
Easy as can be.
I'm happy.
That's cool though, because you like berries and stuff
I
like
do.
that.
I love the Barbados cherries. That's my favorite so far.
I'm excited for ours. It's kind of taken a while to get established. But it's also
Do you
like,
water it enough?
yeah, we have our irrigation on, like a timer.